in the last discussion, just to kind of connect a thread, I heard a lot about equity, and I'm not going to get the quote exactly right, but it was something to the effect of inequitable outcomes are often the result of inequitable processes. And I'm really excited about this next conversation because it's going to dig into some of the reasons why we are ending up with these inequitable outcomes inside of our retirement savings systems. And the TLDR here is it's really complicated, but we're starting to get a much clearer picture of the drivers of inequitable outcomes of retirement savings. And I'm super excited to hear this group talk about what we can do about it. So I'm going to ask this next group to the stage. First, we'll have Kara Watkins, who is the Fearless Moderator, Inclusive Saving and Investing Lead at the Aspen Institute Financial Security Program. Aron Szapiro is the Head of Government Affairs at Morningstar. Jason Fichtner has many hats, but I think the one we're going with is Chief Economist at the Bipartisan Policy Center, is that right? But there are also others, which I'm sure you'll discuss. And Surya Kolluri, who's the head of the TIAA Institute. And I'll be handing the mic. Actually, no, you have a love. Surya is going to begin by sharing some fresh data, some research from TIAA, and then Kara will moderate a discussion with this terrific group. So Surya, I will hand it to you.
Karen, thank you very much. I appreciate it. Glad to be part of this panel and set the stage on some of the research that we've been doing. So we're going to be publishing this study in January, but I thought I'd use this opportunity to give a sneak peek on some of the data that we've identified from an inequities perspective. Just this weekend, I was playing IKEA Dad in Cambridge, putting together IKEA furniture for my son who's just started work. And so we put the furniture together, and wouldn't you know it, at the end of it, I had an extra nut and an extra bolt in my hands. And I'm like, in 30 years, this has not changed. And I was praying that the Chester drawers wouldn't crash on my son at some point. But I was also thinking, listen, we're launching this young person into the workforce. Will this person be ready? But that's just one dimension. Will this young person in the system be adequate for him to retire in comfort? But there are other dimensions as well. How about male and female? How about race and ethnicity? How about persuasion? All these dimensions need definition, need data. So it's not enough to say we're living longer lives. Who is living these longer lives? And what are those inequities? So what I'm going to do just for the next few minutes before I join the panel is to kind of lay this data out in front of you. And as you see the data, you're going to say, Surya, what does this mean? What is driving this? And in these 10 minutes, I'm not going to have the opportunity to explain those, but hopefully we do it in the panel and in subsequent conversations as well. So let me see if the slides move forward. So we're going to be talking about these dimensions, gender, age, race, and ethnicity, on what are the topics where I'm going to share this data with you. It's going to be retirement savings and confidence, some of the topics that Ann Ackerley mentioned this morning. Sources of retirement funding. You're going to find this pretty interesting. What sources of funding are people expecting to depend on in their retirement? Emergency funds, you might have heard Ann mention emergency funds. So I'm going to share a little bit of aha there. There's a way in which you should ask the question to get to the bottom of what emergency funding is like. And then mental health, we know that's raised to the top. And then this is my mic drop chart, I'm telling you right now. Medicare knowledge is going to confirm what Ken told us, but it's going to give you data on it as well, and then whether or not we use financial advisors. So that's the lay of the land in a quick snapshot. So here is retirement savings. And here's what threw me when we asked, do you have retirement data to fund your retirement? And look at the percentage of people who said they are unsure. They don't even know that they have how much retirement savings they have. And you see that broken down by race and ethnicity as well. So that's the first point, which is people are unsure. The next chart, and I'm trying to look for the chart on my screen, which I can't see yet, so I'm going to look this way. We also asked about their confidence to retire. And you will see in the retired column, at what age people retired. So when we talk about people retiring at age 65, I'm showing you data here that that is not true. There's a whole bunch of people who retire way earlier than 65, and almost 30%, 27% retire at 55 or younger. And so you might ask the question, who are these folks? And why are they retiring? What kind of jobs are they in that's causing them to retire so early? And then on the right-hand side, we ask about confidence. How confident are you about retiring? And you can see nearly 40% said they're not confident that they'll be able to retire and that they're going to be working in their retirement. And you can see the breakdown by race and ethnicity as well. I'm going to ask my friend Marcus's help to put the slide on the screen so I can refer to the data instead of looking back at the screens. So let me take you to the next one, which is what are the reasons people are giving not to retire? And you can see this here. Financial, can't save enough, supporting family and friends. This is the caregiving point that we heard this morning, and then maintain the desired lifestyle. And then also like behavioral reasons, wanting to, folks who are enjoying careers, etc. And so there's a significant portion of the people who say they don't want to retire. Now, of course, we do want people to work longer and kind of have a sense of purpose. But the folks who are saying here that they're not going to retire is because they have no choice, that they have to work. Now, this is a bit of a eye chart in terms of data, but it's full of nuggets, and I've put some nuggets on, red circles on important pieces of data here. So if you look at what are the sources of retirement income, retirement accounts, Social Security, money saved outside, employer pensions, paid employment, I'm not sure. You can see it broken down by male and female, the different races and ethnicities as well. And you'll see a super majority of people are depending on Social Security. You can see that one red circle. But if you look at the Black African American population, that column down, they're clearly indicating what? They're clearly indicating they're going to be working, paid. And then if you go to the very last and look at the Hispanic Latino population, what are they saying? No idea. Not even sure where it's going to come from. Right? So this is the sources of retirement landscape. Emergency funds. So one of the things that we do in research is ask people, do you have emergency funds? And we show you the answer on the left-hand side. But I really think that's the wrong way to ask the question. The right way to ask the question is, should you have an emergency, can you come up with $2,000? Right? Because people don't know what an emergency fund is and setting it aside, but can you come up with those money? So what you can see here is 30% of those without an emergency fund who said that they did not have an emergency fund could not come up with that $2,000. So that is the striking finding in our research. And you can see that broken down by race and ethnicity. And you can see the one that I've highlighted in green as the majority of people who can say they can come up with that $2,000. So that's on emergency funds. Mental health, I was surprised by the positivity that I see in the data here compared to the headlines we see. But one confirming statistic, if you look at the very right-hand side by age, you can see that the really younger demographic, Gen Z and millennials, point to mental health being an issue. So I wonder if this is more about being comfortable talking about it rather than anything else, because this is self-reported data. And then Medicare. So second, I think you're going to find this interesting at the very bottom. So we asked people, what proportion of your medical costs will be covered by Medicare? And we gave them options. And you can see in the red circles, the percentage of people who gave the correct answer, those who have retired and those who have not retired. And if you look at the bottom, the purple, where people say they're not sure what it covers, there are 29% of people who are retired who do not know, who are on Medicare, who do not know what Medicare covers for them, right? So if this is not a clarion call for education on Medicare, I don't know what is. And then you can see the breakdown by race and ethnicity as well. So I'll conclude. I don't know if I've used up my 10 minutes, but let me conclude on this last page in terms of access to financial planning. So those who have not retired, it includes all ages. Only a fifth have access to financial advisors. And you can see it's fairly not a rosy picture if you look on the right-hand side in terms of the groups who have not accessed financial advisors, right? It's pretty low in the Hispanic Latino community and the Black African American community, et cetera. So that is kind of the landscape. When we talk about inequality, inequity in the system, let's break down the data by race, by gender. And you can do the same study from a longevity perspective, and you will see the same kinds of breakdown. We've looked at CDC data, we looked at data from Social Security, and it breaks down exactly like this. And so this is the kind of research we need to do to say, how do we address the needs of specific populations? So let me pause there and join my panel for a panel discussion.
Can you hear me? No, there we go. Hi, everyone. Surya, thank you so much for kicking us off. And I'm really excited to be here and to be talking about this issue in the context of retirement security, as well as layered on in health, aging, all of the above. So I'm Cara Watkins. I'm with Aspen Institute's Financial Security Program. I'm joined today with some really awesome panelists. So Surya Kolluri, head of TIAA Institute, Jason Fichtner, chief economist at the Bipartisan Policy Center, and many other titles, and Aron Szapiro, head of government affairs at Morningstar. So I will not waste time. I think the panel this morning and all of our panels have done a really good job of setting up these conversations that we're about to have and dig deep, but not get too wonky, right, for the retirement nerds that we are. We know that, you know, why we're spending a lot of time talking about retirement here in this conversation in this room is it is one of the largest sources of household wealth for most Americans. With that as maybe the premise, I would love for you all to introduce yourselves. Your titles do not do you justice, and answer the question of what does equity in the retirement savings system mean to you? How does it show up? What does it look like? Aron, I'll start with you.
Sure, great. We'll start. So when I think about equity in the retirement system, a pretty simple definition. Is the system working across demographic groups to give people a secure retirement? And I'm using kind of a squishy term there. I mean, what I mean by secure retirement is, are they able to meet their expenses in retirement, which may be different from expenses during working life, while basically maintaining the standard of living that they had in their working lives? You know, obviously, there's a lot of other issues of inequality that need to be addressed, you know, pre-retirement. But just in terms of, is the system working? And when we look at it, and we've heard from a lot of speakers already today, you know, depending on how far you zoom out, clearly it's not, right? You have this huge racial wealth gap. And even when you zoom in and you look at, okay, among people who are lucky enough to have access to a plan at work, there's still a really big gap. It's not as big, but it's still quite large. So, you know, that would be my definition of equity. And, you know, our retirement system does not seem to be particularly equitable at this moment.
So, hello everyone, I'm Jason Fichtner, Chief Economist of the Bipartisan Policy Center, which is a think tank in Washington, D.C. And it is the only organization registered in the District of Columbia with the word bipartisan in its title. And as an economist, I'm not sure it's a supply problem or demand problem, but it kind of gives you the idea that it is a problem. So that is one of the hats that I wear. And as Cara's been joking, I have a lot of sort of, some people can't keep a job. I unfortunately just can't keep one. I have several. So besides being the Bipartisan Policy Center, I run the Retirement Income Institute, the Alliance for Lifetime Income. I'm also the chair of the Puerto Rico Pension Reserve Board, which came out of the bankruptcy of Puerto Rico for the defined benefit plans. And I recently started a fellowship here at the Stanford Institute of Economic Policy Research. So I'll be out here a few times over the next year. I do a lot of work on Social Security, retirement security, and tax policy issues. When we think about equity in retirement, this goes back to my days over 10 years ago when I was the Deputy Commissioner and Chief Economist of the Social Security Administration, where I saw firsthand the implementation of the Retirement and Disability Program, what equity, what access, what it meant to have differences in your ability to adjudicate a claim for disability, and what that meant for people's lifestyles along the way as well as when they got into retirement. And so equity is a more of a big picture issue for me. And you also realize when you start talking about access, we have a lot of discussions about getting people access, getting people the same idea of meritocracy. What does it mean? I think it also is important to realize that we can have people with the same abilities but where you finish often depends on where you start. And so we've had conversations about equity, about access, but also it's between whether or not you had student loans, or you had loans that you didn't have loans, or you had a college paid for by your parents, or you got grants, whether or not you had to take out debt when you got out of college to afford your lifestyle and your rent beforehand and didn't pay it off. Were you able to do the credit card game and do the lower interest rates for 6 months? You start looking at the data and you start seeing people with similar incomes have very dissimilar outcomes. And how do we address that when thinking about equity? And just to give you a sort of a bigger picture, because we're thinking about this also globally, we are now looking at a very aging society globally, where you have basically a lot more people who are getting into retirement age and a lot less younger people working. So what they call the dependency ratio is declining, where you could have had 5 people working for every 1 retiree, now it's getting to 3 to 1, and it's going to get smaller from there. And we are now approaching what we're calling the peak 65 moment. So in the US, roughly 10,000 people a day turn 65. Starting next year, it'll be close to 12,000 people a day turning 65, which is the traditional, if you will, anchor age for retirement. Folks might work longer, folks might work less, they might want to retire, they might not be able to, might not be able to work, but we're now seeing that bulge of a 65 age population hitting its peak. That puts financial pressures on countries. So think about financial pressures as a result of aging. You get pressure from above. As people get older, they demand more pensions, Social Security, for example, healthcare, Medicare. They demand less education. They're not going to go to school. And if their kids are already basically out of school, they're not demanding the K through 12. Then you have financial pressures from below, which is again a declining sort of support ratio, which means those people who are paying for services are going to want their own services, but they're paying so much now for the dependency of the elder population, which is going to cause some generational strife. So when we think about equity, it's across the board. And I always say about equity, for those of you who are like math majors, you probably see these graphs, these X and Y graphs. So you have your X and Y axis, so you want equity across generations and across basically age groups. You want vertical equity, that's sort of thinking about it across income spectrums. But you also got to think about the Z axis, and that's generationally. You got to think about the generational equity. If we today, we're going to talk about Social Security, according to the last trustees report, the retirement fund will be depleted in 2033. That's 10 years. That's actually when I turned 62, which is the early eligibility age for Social Security. If Congress and the president do nothing by then, the program is technically self-financing, which means it'll only pay out in benefits what it collects in payroll tax revenue, which is about 77% of promised benefits. Everyone gets basically a 25% haircut. Self-financing, how does that sound when looking at Surya's charts about people's reliance on Social Security? If we were to increase retirement age and we hold people who are today harmless, say 55 or above, who does that impact the most? Today's younger generations. If we also raise payroll taxes to cover the shortfall, who does that hit the most? The younger generation. This is an issue that is not just for those who are turning 55 or 65 today, it's also the generation that is coming up. If you think back to the last major reforms, then I'll pass it over to you. When we think about equity, in 1983, we did the last major Social Security reform proposals. We are still not finishing up implementing the change in the retirement age today. Basically, it's a 40-year slow increase in the retirement age to 67. If we do that, say, to 70 going forward at some point, then people who are basically not born today will also bear the brunt of the change. You can argue whether that's right or wrong, but it is an equity issue that we have to consider when thinking about how we design these programs, how we pay for them, and how we make any changes that might be necessary, including how we think holistically about the role of the private sector, employers, and the public with Social Security and public pension plans, and how we do this together.
I always enjoy listening to Jason and talking about Social Security, so appreciate the opportunity here. So I'm with the TIAA Institute. TIAA serves teachers across the country. We serve the higher ed market, the healthcare market, and also the nonprofit industry. And the company was founded in 1916 by Andrew Carnegie, and he was on the board of Cornell University and saw teachers retiring in poverty and said, we need to fix this. And we have a 100-year history of addressing that issue. And so the focus we have now is the theme that we call retire inequality. So take that approach to the broader population. And the institute itself is founded inside TIAA to do research like the ones I just shared with you. And we just celebrated our 25th anniversary of founding this year.
level set. I also want to set this conversation up. I think we did a really good job already and earlier today talking about, you know, the key issues around retirement and saving. I would love to kind of level set in the same way around longevity. So when we think about longevity, and I guess, Surya, this goes to part of your presentation as well, you know, is it increasing? Is it declining? And if so, for who? Can we get a little bit more? Can we pull the hood up and unpack some of the numbers and what we're seeing in terms of equity as we've established? So
Yeah, and there's that, and there's also knowledge of longevity. If you heard Chip mention this morning that some of the work we've done is on longevity literacy. So we have been studying for many years now financial literacy. Do we understand a stock, a bond, interest rate, inflation, et cetera? So we said, why don't we turn that and ask people if they know how long they're going to live? So we said, if you jump past infant mortality and you get to age 65, how long do you expect to live if you're a man or a woman? And we even provided the answers as options. And then I don't know. And a third got the answer right. And a third said, I don't, even if you give me the answers, I'm not going to guess. Right? So people are taking on longevity risk by not knowing the answer to this question, right? If they say they're going to, you know, pass away sooner than what the mortality tables are showing, they're taking on longevity risk. So how do you address this? And there was an amazing flipping of the script that happened. So when you study financial literacy, and it's been going on for a decade now, women always lag men in financial literacy. And over again, across ages, across affluence, women lag men in financial literacy. So we asked the longevity literacy question, and the script got flipped. By the same amount, women lead men in longevity literacy. So we can have a whole conversation, but why did that happen, right? So when we think about financial planning and longevity planning, we firmly believe both partners should be in this conversation to have a longevity fitness dialogue. So that would be mine.
Aron, you and I were talking earlier about this. I would love if you could share your thoughts.
Yeah, I mean, so one of the things we do at Morningstar is we have a model of retirement outcomes. And so I was actually just scrolling on my phone, Excel table of our assumptions for longevity risk and the probabilities of living to certain ages. And so this was prepared by an actuary that I work with. So it's a very dry kind of table. But then you sort of squint at it and think, this is like really depressing, because if I know a couple of things about you, if I know your marital status, income level, gender, race, I'm going to get a very different answer for how long you might live. And that could vary from a life expectancy contingent on reaching age 65. Okay, so like you've already made it to Medicare eligibility and maybe retirement, sort of depending on how we're thinking about retirement. Your life expectancy could be 82. It could be 89. It could be 91, and that was the highest one. The probability that you'll have an unusually long lifespan also varies quite a bit. So you have a 30% chance in some of these groups of making it to 95, a 30% chance of only making it to 87. Now, like that to me speaks of a pretty big social problem, both pre and post retirement. In terms of sort of the individual planning aspect of it, I don't think this is very helpful information, other than it is not encouraging, because you still face as an individual tremendous amount of randomness, right, with your longevity. And so you sort of, no matter what group you're in, you have, I think it is, the risks of having an unusually long lifespan, if you haven't saved for it or not prepared for it, are unacceptably high, sort of no matter who you are. So, you know, you still have to prepare for a long lifespan, but it is really shocking when you look at the stuff and see these gaps. So yeah.
This goes into, think about it this way, right? So you made the point about contingent on reaching age 65. So you may have seen a lot of news stories recently that longevity is declining in the United States the first time in years. Well, that just depends, right? The best answer in economics is it depends. It really depends on mortality, but you think about birth cohort, but it's contingent on reaching a certain age, so period cohort. And what you're seeing now is a lot of those deaths are caused with Angus Deaton called the death of despairs. They could be basically drug overdose, other types of issues. But once you hit 65, the script changes. Longevity is still increasing for men and for women. And basically, if you hit 65 today, you have a 1 in 3 chance of hitting age 90, or a 1 in 7 chance of hitting age 95. Income is a big correlation and predictor of how long you live. I don't know if it was Jim Perturba who was on the CREF board, but so there was a presentation a few years ago, I think it was Jim Perturba, basically ran a model and said, contingent on income, how long can you live? And his model says forever, if you have enough money. Right? What does that mean? You can buy healthcare, but the point is healthcare is expensive. This gets to the idea is how do you actually plan for this? There's dementia, there's a variety of issues that come in with cognitive decline. How do you start planning for this as well? How do you plan for a life in which you could be living to 90, 95? We're going to have more people turning 100 than ever before as well. How do you plan for that? What does that mean for Social Security? What does it mean for our defined contribution retirement plans where people have an asset? Are they afraid to spend it down? How do we help them plan that? BlackRock's working on that. TIAA is working on that as well. How do we do this? How do we think about Social Security reform in the sense of there's folks who can't afford to retire later than 60 and not live long, versus those who will hit 85 need a higher income level from 85 to maybe 95 to have healthcare. How do we think about those tail ends when we think about the idea of reform and adequacy? And those are the discussions we're having. And I think to a point you made earlier, Ken, we actually are doing something about it. So there are actually programs in place now that will actually put some of these projects and programs and procedures and products into defined contribution plans. Again, BlackRock's doing some, TIAA is doing some as well. So we're actually taking action on this now. I think it's gonna be helpful to see how this all plays out in a few years.
Just a quick thought. So I'm going to ask everybody a question here. So when you double click on what was just said about us living longer, we went to the CDC and said, who is living longer? And we got 8 sets of data. So I'm going to ask you which of these 8 lives the longest, right? So we got Black African American, male, female, white Caucasian, male, female, Asian American, male, female, Latin American, male, female, right? So it's 8 categories. So 2 hints, affluence and longevity are correlated, and women live longer than men, right? So with those 2 data points, if you had to guess which of these 8 live the longest, what would you say? I would have said white women, Asian women. Ken? So the top 2 are Asian American women and Hispanic Latino women. And it is not correlated to affluence when you go down one level. So we can have a whole conversation about what socioeconomic drivers are making this happen.
Thank you. So I think pulling it back a level and also connecting it, we talked about race, gender, age, generation, said that, and location, geography. So when we think about that and where you sit in this field of, we spend all day thinking about these issues, what can you share for us on what's not working in this system? And what are some of the key drivers or key problems that we should kind of zoom in on? Who wants to start? Jason.
That's a big topic. So a few things that come down to this. One is the idea of healthcare and trying to contain healthcare costs. And so, Ken made the point, and I was thinking about this in the audience, about our healthcare being, I won't use the word he used, but less than ideally efficient. And for someone who has studied healthcare, you can figure out a way as an economist to wring out efficiencies throughout the system. I could go through and all you would nod your heads. But keep in mind with the US healthcare system, for every inefficiency we find we want to change, it's income in somebody's pocket, right? And that is part of the system problem, is that this system is basically has a part public and a part private plan, and other countries do things much differently. We have a lot of innovation, things cost money, but we also have a lot of waste in how we spend that money on new procedures and technologies that aren't actually worthwhile. And a big demographic voting population that wants the best and brightest and the best technology, but it's not the most efficient or effective technology. How do you put, I'm going to call them price controls for lack of a better term on it, but how do you actually do something that's a market? So for an economist, if you think about what a free market is a willing buyer and a willing seller with transparency and symmetric information. So not hiding anything from you. Who here thinks they understand their healthcare system? So even if things are transparent in a way that is disclosed to you, you don't understand it. To the point about getting the bills in the mail and trying to figure, Dr. Google now is sort of where I go for everything. I figure out what the heck is going on, and I'm not sure how accurate that is. But that's where I go, because I have no other place to really sort of figure it out. Again, I'm a relatively intelligent person. So this is the problem we have when it comes to thinking about markets for healthcare and prices, and that gets to an equity issue and goes to the financial literacy issue as well, and a time issue. Who has time to do all this research? Medicare, you're doing open enrollment, changes every year. You got to make sure your medications are on your same prescription plan. That's a problem. The costs are a problem. So this is going to be one major issue for equity that does the entire landscape of generations, as well as those with different racial backgrounds and income backgrounds. That's one thing. The other, again, is the access to savings plans. We are moving completely away from a defined benefit world. We're now going into a defined contribution system in which there are now more DC participants than DB participants, both from working and also now in retirement. There are more people on DC plans than there are in DB plans. That's changing. So realizing that, how do we get people better access and ability to save? It's one thing to have access. If you can't afford to save, you can't save. And then once they get to retirement, how do we help them take that nest egg and help turn some of that, at least, into protected income on top of Social Security? So that, I think, is how we start thinking about this holistically as a public-private type issue together, and not just one or the other.
Yeah. So, I mean, you hear Morningstar, you probably think the fund ratings. So I didn't go into a whole thing about what we do. But one of the things we do is we try to assist, we assist employers who sponsor retirement plans. And so I totally agree with everything that's been said about access. It's clearly a huge problem. I don't know how to solve it. I mean, it's, politically, I don't know how to solve it. But then when we look at the employer side, I alluded to this earlier, we still see really big differences in three dimensions. So one is participation. So even if you have access, are you participating? One is contribution level. So even when we control for income, we see really big differences in who's contributing, who's able to contribute, and therefore, in a lot of cases, what kind of matches they're going to get from their employer and where that money's going. And then the last thing, which may be a little less obvious, is pre-retirement withdrawals. So who's taking out money for hardship withdrawals or in loans that are not repaid, money that is coming out of the system and is therefore not available for retirement. And if you could do interventions around that, you would boost retirement income for some of the less well-served groups by like 30%. I mean, it sort of varies on how you do the simulations, but it's a big, big, big impact. And so, those are areas where I think I kind of do know how to solve it. It's a matter of working with the employers who are sponsoring plans. And one thing to just keep in mind about the US retirement system, about 2,000 employers cover 50% of people who have access. So you're not talking about that big of a universe of employers you need to reach. And they're working with kind of a handful of the same record keepers, asset managers, consultants. So it's a reachable group. In fact, I think on this project that I've been doing with Aspen Institutes, I think we've probably talked to half of those employers. It's soliciting their help, getting us data to study this more, right? So I mean, they're there, and that kind of lets you see what interventions might work, what might not, and then maybe you'd get public policy that comes out of it. So just sort of from where I sit, and I recognize that's narrower than a lot of the big themes we've been hearing about today, but I think some of those seemingly smaller changes could make really big differences in how well prepared people are for retirement.
In terms of what's working, what's not working, is we've done a lot of huffing and puffing around training and education, and things don't change. So I'll give you an example. When we went from DB to DC and we had to contribute into our own 401k or our own 403b.
Surya, can you explain the difference between DB and DC?
DB being defined benefits and pensions that my father had, versus defined contributions where we are putting in money into our own retirement savings plan. So when that happened, we did a lot of training and education saying, this is good for you, please do it. Please put money into your retirement account and the company will match you. And if you don't put money in, you're leaving free money on the table, right? We did this for years and years and years to no avail, right? All the education, all the training, all the camps, nothing worked until a feature called auto enroll and opt out was put in, where we said, well, unless you opt out, you're going to start contributing. And guess what? Very few people opted out because you took advantage of inertia. And then we said, we're going to auto escalate. Every year, we're going to bump it up a little bit. And nobody protested. So part of what is not working is this reliance on saying, if I tell you, I think you're going to act differently, is not a necessary and sufficient condition. So we got to put interventions in place where we can help people help themselves. One other example, companies roll out all kinds of good benefits, right? And so when I do seminars and others for my teammates, they will say at the end of it, I did not know we had this. I'm like, there were a bazillion emails bazillion texts, bazillion sessions, and you still do not know it. And it is not a fault of anybody other than we're all busy doing what we do. And when we have a need, we need help, right? So we need to solve that communication conundrum as well.
Okay, so that leads me in from setting the stage on the problems around retirement inequities to the solutions. So when we think about how do we fix the system, right? Like there are still 57 million plus private sector workers who don't have access to a retirement savings account at all through their workplace. We see longevity is not equally distributed across people and zip codes. And we've talked a little bit about not just, financial education, but also some of the behaviors like nudges and auto escalation, Surya, that you just mentioned too. When we look at the systems change of things, where would you place financial education as a solution? And I don't know, Aron, you're smiling, so I'm gonna call on you
I'm very
first.
skeptical. I think it depends what you mean by financial education. And let me be clear, I'm restricting my comments to financial education about retirement savings and investing. Right? I don't like have the education, the knowledge to cover it for things like credit card debt or what have you. But I'm skeptical for a few reasons. First of all, to me, it makes very little intuitive sense that in addition to whatever your career is, you should also be an expert in retirement savings and investment. Like, I just don't get that intuitively. We don't ask people to do that for anything else, right? And nobody, and this is a very new idea, nobody would have said that 15, 20 years ago because most people were still in traditional pensions and they would have gotten a benefit in retirement if they had access to a pension that was based on some creditation rate of years of service and salary. And so it would have made no sense to talk, right? They didn't need to know how the plan was investing. I still don't think they really need to know how the plan is investing, particularly because we have these great tools with inertia. So if we auto-enroll people in either, in an appropriate asset mix, either through a target date fund or managed account or whatever it is, right? We don't need to get into those details. And then auto escalate, that's going to be, I think, much more powerful. I'm not averse to some just-in-time education, particularly as folks get closer to retirement and they need to think about converting some of that saving into lifetime income. I think that can be helpful. I'm very skeptical that teaching kids in high school sort of about investment practice is going to be particularly helpful. And the other thing I would just note is, when you look at participants who think they know what they're doing and they start investing and moving money around, they almost always try to time the market and they almost always come up the losers on trades they are making with counterparties who are professional investors. So I am very skeptical that it is better to do that than to just leverage inertia, which works. I mean, it is the most powerful thing we've found. So I don't know, it's not high on my list of interventions.
We like to say people will people. And Jason, as a behavioral economist and all of your titles.
So I agree with Aron, but I'm going to add a but onto this. He is right in the research and the way people behave, and that defaults are better for getting action than it will be just for like an education. And the just-in-time education is important too. When someone comes in and it's their first time, this is the access to the plan. What do you want to do? We're defaulting you in. Do you want to opt out? Those kind of things at just-in-time are helpful. That said, I still think we have an education problem in this country. And you can see in some ways, I don't want to draw a correlation, but I'm going to anyway, with the political divide in this country. I think you can start seeing there's a drop and we'd stop teaching civics in high school. I think we should be teaching financial literacy, financial economics in high school and civics, just because it might make us a better freaking country. And that might also make it easier when explaining defaults to people. They know there's a stock and a bond. They'll understand how a portfolio allocation is supposed to change over time to do a target date fund, which for most people in defined contribution plan is where their money is now. Everyone puts in a target date fund, sets and forgets it. That's where most of it goes. So the education is not necessarily going to change the outcomes. And I think that's the important thing, but we should probably still just do it to have a better literate society. And also gets to the idea of how we talk about risk. So people are really, we talk about longevity. We talk to financial planners, so I do this stuff enough now that we talk to people a lot. And it's sort of like, what kind of risk do you have to worry about in retirement? So someone says longevity risk. What else do I have to worry about? Market risk, inflation risk, sequence of return risk, right? Cognitive risk, health risk. Everyone always forgets my new favorite one, by the way. political risk. Who's going to be ahead of Congress and the president in 2033 when the Social Security trust funds are depleted, assuming Congress does not do anything in the next 10 years, which seems like Congress to me right now? Do you want to bank your Social Security retirement on who's going to be in office? What does that play into your financial literacy planning? You start thinking about risks. If you're an advisor, how do you help people understand this? Is that the power of delayed claiming? Is it needed to claim earlier? Do you have better protected income strategies in your DC plan on top of Social Security? These are all longevity. These are all risks. These are all financial literacy concerns we should be talking about, and people should be able to understand. And I think we're not going to be able to do that in some ways if we don't have better education. So I'm with you on not changing, it won't change the outcomes, but I think it will make for a better informed public, which could make for better policy outcomes writ large.
I'm going to strike a pretty optimistic note here. And I'm going to, at the end of this, I'm going to redefine what we think education means, right? Because I'm going to say education is not sitting in class and passing an exam in this context. So my optimistic note with 3 examples. First, imagine if you had a software that ages you, right? So I'm X years old, and it's going to present me with how I look when I'm 70, 75, 80, and psychologically motivate me to take care of my future self. What might that do to my behavior? Example 1. Example 2, on my phone, I get an alert that says, people like you do this, right? Like Amazon or Netflix or others do. We have the technology to do that. Thirdly, I get alerts saying, so if I put a budget parameter in my tool and say I want to spend X thousand dollars, and as I get closer to it, I get alerts saying, Surya, no more restaurants for you, right, in that month. And you know the generation that's coming up is very comfortable in that environment. So I believe with big data and technology, we can surround people with education, which is not passing an exam, but giving them information to make decisions.
And on that note, there already is some research to show, for example, using data. You take a large employer, and the employer looks at their payroll withholding, and they send Ken a note and says, Ken, we notice you're contributing 5% to your defined contribution plan. Your colleagues are contributing 8%. Would you like to up it today? Right? That's like a nudge, but it uses behavioral insights to do that. Ken may say no, but a point is you're now giving some information off data to make an awareness about how they're competing with their peers. And people like to have that sort of competition type thing and understanding. So and this is to your point about education. Like, what does it mean? It's information. How do we get better information out so people can make decisions? How do we nudge them? Not force them, but nudge them. I do think like things like auto enrollment, auto escalation, always have an opt-out. So no one says they're being forced to do something against their will, but the opt-outs are important. It's that libertarian paternalism. I think is very important when we think about that with education in mind.
Mm-hmm. Thank you for indulging me in that question. I know I did not really prepare you for that beforehand. With that, with understanding the data, and maybe, Aron, I'd like to put you on the hot spot. You are one of the principal leads on the Collaborative for Equitable Retirement Savings. What is the project, and what are you learning? What are the insights that can be applicable on the broader level?
I'm sorry to start using words like administrative data after lunch, but I mean, here's the project, right? There's really good survey data that paints a pretty good picture of the problem, and it's been cited a bunch of times today, right? So there's a survey of consumer finance, and that gives you a pretty good sense by the race and ethnicity groups that we categorize people by in America, which is 4 broad groups. We can see where there are differences. Here's what we can't see. We can't see anything about the retirement plan that these people in the survey are participating. So we don't know what the match structure is. We don't know, well, that's a pretty big one. We don't know what the rules are around pre-retirement withdrawals, right? We don't know what the investment allocations or investment options that are available to them. We just don't know any of that. And so what we've done is we've asked lots and lots and lots of companies to give us their data. We've got about 300,000 lives now in this database. So we can really look at the variation in plan design and what that might mean for more equitable outcomes. We're not quite ready to publish results, but we're getting there. But I can tell you preliminarily that, and I talked about this a little bit, but I'll just repeat it really quickly, that you see some discouraging stuff and some really encouraging stuff. So the discouraging stuff is even controlling for income, we see pretty big differences. Big differences in contribution levels, participation rates, and ultimately account balances, which are going to flow from those things. But I think there are also a number of areas where changes in plan design, changes in the way the match is structured, A lot of the plans we're looking at are already auto enrollment, so that's already kind of covered. But as we get more variation, we'll see some of those differences too. But kind of again, things that might seem not sexy and exciting could make a really big difference. And in particular, I'm really interested in this pre-retirement withdrawal issue. There, I think there's probably a mix of things. Bolstering access to emergency savings accounts, some just-in-time education, although if someone really needs the money, they really need the money, but also making sure people re-enroll afterwards, because most plans, this is very subtle, but most plans, not all, but most, will suspend you from contributing if you take a hardship withdrawal. And then you never get re-enrolled, right? And so all the stuff we're doing to leverage inertia all of a sudden is just out the window, and that can make a huge difference. So it's little stuff like that I think could add up to a pretty big difference. Again, just within the context of people who already have access. On the other hand, a lot of other energy is going into things like auto IRA in California and in Oregon, where we're trying to get people into the system. And so I think it's important to also try to improve the system for people who already have access. So that's what the project is focused on. And again, I mean, the data showing the problem exists. The data showing the variation in the retirement system doesn't exist. So we're creating it, and it's super exciting.
Thank you. Jason, I'm wondering, Social Security is such a big component of retirement security and our retirement savings system as we think about it as a whole and plan for it. I'm really curious, what can we do to leverage lifetime income, both in Social Security and on the private sector side? Where's the opportunity?
So this is one area which I've done a lot of work on. I did a paper with Bill Gale at Brookings and Gary Koenig at AARP, which we called Start Accounts. I'm doing some work now with TIAA and BlackRock and others, and it's all around the idea of how can we help people facilitate delayed claiming Social Security. So just to refresh, what's called the early eligibility age for Social Security retirement benefits is 62. Horribly named. There's legislation now that would change that from the early eligibility age to the minimum benefit age, because it's a minimum benefit. You get more if you delay claiming, but some people can't afford to delay. So if age 67 is your full retirement age, another wrong word, and you were to get $1,000 a month, your age 62 benefit is $700. It's a 30% reduction in your monthly benefit for the rest of your life. If you wait to age 70, that $1,000 is $1,240. That's inflation adjusted for the rest of your life. The difference between the two is 77%. Where can you get a 77% increase in your monthly benefit by delaying claiming for several years? Now, some people can't afford to delay. They've worked a hard life. They don't want to claim. They want to retire. How can we help them facilitate delayed claiming? And this is where the private sector comes in. You don't have to convert all of your 401k assets into a lifetime income product. What if we just helped people delay claiming for 5 years? So someone comes in at age 62, says, I want to retire, or I can't afford to work. I want to claim Social Security, I'd get $700 a month. And we say, you've got some defined contribution assets. We could turn that into a 5-year annuity that basically gives you your $700 for 5 years and allows you to file Social Security and claim at age 67 for that higher amount for the rest of your life. So many people are relying now, Surya's research was showing us as well, people are relying on Social Security. How do we make that, again, it's a bedrock. How do we do that? It doesn't require us to do any sort of changes to public policy or reform the trust funds or tax rates. It's supposed to be actuarial neutral, and there's questions about for whom it is. But if we can help people delay claiming and facilitate delayed claiming, that would go a long way towards helping people in retirement when they need the money most in older ages. I think that's an important thing. It also has spousal protection. Spousal benefits are higher if you pass away, if you delay claiming earlier, later. So these are how I think we should think about the private sector and the DC plan and how we think about options. TIAA has what's called the income test drive. I know they're doing research on that now to see whether or not that'll help the behavioral. But the idea is people are afraid of giving up a lump sum up front for a stream of income. What if we try you out for 2 years? Here's an annuity. We're going to give you basically monthly income for 2 years. After 2 years, you don't like it, you can get the rest of your money back. But we're going to assume that you're going to like getting that protected income and you're going to keep it. So how does that help with the behavioral? How does it design? How does it help with income security and retirement? These are sort of the things we're doing. I think we need to, again, think holistically, but that's where I think there's a lot of options for the private sector to come in with products that help facilitate delayed claiming or provide some protected income on top of Social Security, which is still the bedrock for many millions of people.
So final question for the panelists. And I want to start or end where we started, which is equity and retirement savings system. What's at stake here? What's really at stake here when it comes to what we need to do, what we need to get right, what happens if we don't get it right? Surya, can I pick on you?
Sure. So last week, 2 weeks ago, we had an event in DC that Jason was kind enough to join, where we said, what is the biggest thing we can do to address this inequality in retirement that we've been just describing? And we came up with the idea of the retirement Bill of Rights that we're going to take to policymakers. And the retirement Bill of Rights would constitute 4 things. One would be that everybody has a right to save for retirement, which addresses the access issues. Everybody has access to low-cost investment options, so they're not being price gouged. Have clear information that touches the financial education point. And then finally, a question I did want to ask the previous panel was public-private partnerships, because the government alone cannot do this, private sector alone cannot do this, nonprofits alone cannot do this. So can we have public-private partnerships? So we have tested this on the Hill. It's being well received. Jason was there. And so we want to push this big idea.
Jason?
What was the question again? I got so involved that he was like this is a great idea. Wait, what are we doing?
So when it comes to solving this big challenge around equity in our retirement savings system, what is really at stake with both the money that's in the system, the money that's missing?
So 2 things. One, Ken had mentioned earlier about the number of hours that people are going to be using retirement they could have available. Think about the spending in retirement that could go unfulfilled if we don't solve this challenge. So the Boston College Center of Retirement estimates potentially up to 50% of retirees could be at risk, in quotes, of not being able to afford the lifestyle they have before they retire. That roughly, depending on how you do the math, could equate to a $1.3 trillion spending gap. That's not the human side of the equation about what that means for healthcare or ability to afford your rent or your housing, but it does come to a macro issue about spending, in which retirees are going to be one of the biggest spending groups we have going forward. And on the equity side, we have to solve what's called the leakage issue, which you mentioned earlier, because even if we start getting people access to plans and they're in gig type of jobs or jobs that keep changing, we can solve this. The portability, the access issues, but the leakage are the main issues when it comes to access and equity. There's a lot of those minority groups are the ones that change jobs more frequently and then lose that income, and then figuring out why are they taking the emergency savings is important as well. So we hopefully can solve those issues. We'll go a long way towards this challenge.
Thank you. Aron?
I see we're at 0 here. I'm having a hard time with this question because to me, it's like, what's not at stake? So you've got the macro issue, which is if we don't solve this issue, if we don't solve this problem, retirees, instead of being a stabilizing force on the economy the way they were when they were collecting defined benefit plans, become a destabilizing force in the economy. You've got a huge issue of equity. And the reason Social Security is popular is because it's universal and people can see it when they pay their taxes and they can go see their benefit. And there's a feeling that you've earned the benefit, which you have. And look, the second largest tax expenditure, that is foregone tax revenue in the code behind employer-sponsored healthcare, is the retirement system. This is hundreds of billions of dollars a year functionally in government expenditures. And I think the sort of political support for that is going to collapse if the system produces wildly inequitable outcomes, and we'll have to do something completely different. So there's a tremendous amount at stake. These are really important issues to address.
Thank you. And thank you, panelists. This was a really great discussion.